My name's Dr. Reena Duseja, and I'm the Chief Medical Officer of the Quality Measurement and Value-Based Incentives Group within CMS. So our work really within the group that I sit within manages over 20 pay-for-reporting, pay-for-performance programs. And I'm an emergency physician by background and came to the agency a little over 2 years ago. And one of the things that we heard as an agency was the importance of giving a story behind the measures that are within our programs and how are they driving toward value and helping actually improve our patient outcomes and our beneficiary outcomes. And so what I'm hoping to share with you today is a story of that initiative. It's our Meaningful Measures initiative that we launched in 2017. And this initiative really was to get to a place where we can use the framework and tool set to drive toward making choices about the measures within our programs, along with giving us an idea of where the gaps may be and how can we engage with patients and providers in helping to drive to measures that matter really on the front line. So what I'm going to do is first talk about our CMS's strategic priorities, because this actually fits in very neatly to our initiative and was really guided by these 4 strategies that you see here on this slide. So first and foremost, everything that we do really puts the patient first, and we really think beyond the patient, it's really the partnership of that patient within the community along with their providers and making sure that, empowering them to be able to make decisions about their health care. Second is really about improving the CMS customer experience. We have many programs that are mandated by regulation by the Hill that we have to implement, and those programs really need to serve a purpose, not only for whether it is trying to incentivize performance and improvement, but also making sure that the information that we're giving back to our customer, whether it's the patient or to the provider, is actually meaningful information. And then the third and fourth one is actually something that I think speaks to our next phase of our initiative, which is around looking at how we can leverage innovative ways to improve the quality, accessibility, and affordability of care. Some of you might have heard at the beginning of this year, our administrator actually pushed for price transparency and wanting to make sure that patients knew what charges were. Would it be admitted to a hospital? But what is the cost of care? And tied really into that is looking at quality of information. So a lot of work in that space to think about how we could display that information that can help guide informed decisions. And the fourth priority is about ushering a new era of state flexibility and local leadership. And I see this in terms of something very exciting, at least within our group, in thinking about how can we leverage the technology that's emerging. For example, when you think about electronic measures and moving toward common standards of submission of those elements, or thinking through platforms like FHIR or APIs, and how can we do that in a way that can allow for reduced burden but in submission of data, but also in a way that can get data back timely to the patient and the provider to help them make decisions. So I want to take a moment to talk a little bit about the purpose of our initiative, and I alluded to that at the beginning when I started. But the purpose really was to improve outcomes for patients and provide meaningful information to consumers to help them make choices. I believe, and I was talking to Kevin about 2 years ago, I came and spoke about our Hospital Stars program, which is one of our many public reporting programs that allow for information to be aggregated in a way that patients can use and help them make decisions about the care that they're getting. And so this really is an effort with this initiative to hone in on making sure we have those right measures that can lead to informed decisions. The other thing that we heard resoundingly was around the data reporting burden and the costs and systems, clinicians, and other healthcare providers in providing that data. And so we actually looked at that very intensely in terms of thinking about, okay, if we're asking to get this information, how is that information actually useful in terms of our goals of improving outcomes for our patients? And it led to actually a lot of work in last year across our programs to removing measures out of our programs, those that we felt that perhaps there wasn't much more room for improvement, or they were what we call topped out, so measures that have high levels of performance without much variation. So those were some of the things that we looked at when thinking about balancing the data burden with the patient benefit of continuing to report on those measures. The other thing with this initiative, and this is something that we're doing inside the agency as well as partnering with commercial payers, is thinking about alignment of measures. We know that as our agency, even across our agency, that there might be a different measure, similar concept, but have a different specification associated with that. So we're trying very hard to think about if there's opportunities to align as appropriate and to be agnostic based on the setting, that we should do that. And so this framework that I'll be describing to you actually helps us have those conversations. And then the last few things with our initiative is around identifying gap areas for development. So the quality payment program, the one arm of it, which is the merit incentive payment system, sits within our group. And we have looked hard at looking at where are the gaps in terms of allowing for providers who are eligible or will have to participate within the program based on their billing or the number of beneficiaries that they're seeing. How can they successfully participate, and how can we identify maybe gap where there's just really no measures that might account for the care that they're delivering and help move in that direction and being able to address issues where they can be successful within the program. And in addition, looking at some of these higher priority areas. So opioids, clearly an issue in terms of concern, and we've heard it loud and clear from the White House a couple of years ago with the President's Commission around this. And we're looking at how can we actually make sure that while we're addressing patients' concerns for pain, that we're also looking at it from a multimodal strategy and seeing if there are ways that we can cut back on opioids when appropriate. In addition, thinking through nursing home care, making sure that care is safe, making sure there's measures out there that are assessing, for example, patient safety risks such as falls, looking at care transitions, again, thinking from the system perspective of how can we get information across settings so people have the right information as they're making decisions about their care. And finally, this priority of getting more outcome measures. So within our agency, we're looking at, not to say that there's not some value at times of having other types of measures within the program, but as much as possible and as feasible, depending on the area, thinking about prioritizing measures that are outcome-based, that are looking at ways that can be collected in the least burdensome way, but driving toward those things that, for example, looking at mortality or readmissions, or, for example, looking at condition-specific mortality conditions. So those are some of the things that are continuing to move forward. And I would just add that in this next phase with our Meaningful Measure initiatives, we're really moving toward innovation and thinking, as I mentioned, partnering with others and how we can think about how we can get data in a way that does not create as much burden, but still gives us clinically relevant and informative information that can help us with our adjustment of our models. And for example, CMMI just put out last month an AI challenge, and we partnered with them, and we're really looking forward to seeing what comes of that in terms of thinking through how we can leverage technology such as natural language processing and through electronic records and see how we can be able to predict outcomes for our patients. This next slide talks about our objectives, and I think these objectives are really centered around focusing on areas that we can all agree to and also help us lend some specificity to this framework. And I've mentioned some of these issues earlier, but want to focus on a couple of things that are real issues within our agency. One of being which it's important that we continue to address high-impact measure areas that safeguard the public health. Great examples around patient safety. As we were thinking about the burden associated with some of our measures, there was some thought about deduplication across our programs, and we proposed that last year, but we heard loud and clear from stakeholders that patient safety perhaps needs to be in a pay-for-reporting as well as a pay-for-performance program, and I'm thinking in particular around the hospital programs, and we heard that, and I think based on feedback from stakeholders and thinking through this, recognizing this is a bi-directional conversation and tool, we continue to make sure that this is a priority for us. I mentioned the patient-centered aspects. We want to make sure that measures are meaningful to patients, clinicians, and providers, as well as outcome-based wherever possible. One of the other issues is around making sure we fulfill requirements in our program statutes. So depending on our program, some of them actually are mandated by Congress that we have to develop measures in a particular area. For example, in our ESRD programs, there are measures around looking at, for example, we have to have a measure around hypercalcemia. So we have to meet those requirements, and so that is some of what you will see within the measures that stay within our programs. And then, as I mentioned, we really are looking at this risk versus benefit analysis in terms of trying to minimize the level of burden on providers, but also making sure we get meaningful data back to them, as well as thinking through identifying significant opportunities for improvement. So this framework actually came from many conversations that we had from many partners in the field that have been thinking through this. Kevin mentioned the National Quality Forum earlier. They are a partner with us in terms of thinking about, as we were developing this framework, we also derived some of this looking at the Healthcare Payment Learning and Action Network, as well as the National Academy of Medicine's Vital Sign Core Metrics. And we also took perspectives from other agencies, including those within the government, such as the Agency for Healthcare Research and Quality, the CDC, and engaging with many other stakeholders, as well as commercial payers through our Core Quality Measures Collaborative. So one of the things that we do once we have the information is make sure we actually are transparent about the data that we have. And the mechanisms we do that is multifold. We have data that's downloadable, but we also want to make sure that it's available on public reporting websites, and this is really an opportunity for us to optimize getting actionable data out there. And so one of the initiatives that has come up with this administration is around the eMedicare initiative and trying to make sure that we can get data on a platform that we use and tying that to costs and making those decisions when making choices for your care. The other thing is around interoperability. In February, we released 2 rules, proposed rules, one through our agency and one through ONC, looking at how do we help strengthen and facilitate interoperability across settings and trying to get at this question of, do we need to have a unique patient identifier to be able to follow patients across settings? How do we get vendors to help participate in some of the challenges there, but also trying to help build a platform that would allow for that information to go with the patient, depending on wherever they end up being, whether it's an acute care setting such as a hospital or emergency department, or with their provider, or if they're visiting another state, and the challenges of getting data that needs to be timely in informing the care. In addition, we want to engage with patients and providers at the very beginning of the process. So one of the principles that we have with any of our measure development processes, with at least the measures that come through our agency via contractors, is making sure at the very beginning we have that person-oriented perspective. So we make sure that we include patients and caregivers at the start when we're thinking about measure concepts, and it goes all the way through the place before it even gets proposed in the rule as a possible measure within our programs. And I'll just end with the alignment piece. I think this is a critical piece in terms of thinking through how do we align across the agency around measures across settings. So what can be a longitudinal measure that we can follow in terms of patients' care, thinking about infrastructure supports that can allow us to do that, but also thinking about aligning policies and processes as well as programs that can have some flexibility in testing some innovative models with the insight of really getting some alignment across the measures. So this is our framework that you see on this slide. And as you can see in the middle there, we have the provider and the patient and our 4 strategic goals that I started with in this talk. And surrounding that, you can see some cross-cutting criteria here that are principles that we've heard through our conversations that have been agreed upon, and making sure that we're reducing burden of limiting disparities, thinking through how do we safeguard the public health and improve access to rural communities, in addition to tracking to measurable outcomes that have an impact. And then if we're driving toward value, I think part of this conversation is looking at resource utilization and looking at about how do we achieve cost savings and how do we measure that in a way that can get back to the person making those choices and helping them to effectively get high quality care at lower costs if possible. So surrounding those cross-cutting criteria, we actually have 6 areas within our meaningful measures, and I've listed those on the right-hand slide here, and I hope you can see them. So one of them is around promoting effective communication and coordination of care. The other one's around promoting effective prevention and treatment of chronic disease. The third is working with communities to promote best practices of healthy living. making care affordable. The fifth one is making care safer by reducing harm caused in the delivery of care. And the sixth is around strengthening the person and family engagement as partners in their care. And within these 6 categories, we actually have additional areas that dive into this. So for example, around promoting effective communication and coordination of care, we have medication management, looking at admissions and readmissions to hospitals, as well as the transfer of health information and interoperability. I have some resources at the end that you can click on to kind of do a deeper dive on those definitions that we have for each of these areas. But I wanted to provide a little bit more of a deeper dive on one of them. So when you think about promoting effective prevention and treatment of chronic disease, and clearly an area, especially for our Medicare beneficiaries, knowing that many of them have one or more chronic conditions, and it's really important to get a sense of that management and preventive care piece. We thought about this in terms of 5 different areas in this bigger category. One is around looking at preventive care. So this is around immunizations, looking at the Medicaid population, for example, that are pregnant for prenatal care, and also for our kids in terms of well child visits in the first 15 months of life. And then in our programs that are mostly directed at Medicare beneficiaries, thinking through the management of chronic conditions. And for example, you can think about the importance of osteoporosis management, not only in women, but really also in men. And we have measures such that address that in our quality payment program. And thinking of other things such as control of diabetic care in terms of looking at HbA1c tests or looking at hypertension care. And then the other 2 areas here I think are tied hand in hand at times, looking at prevention, treatment, and management of mental health, as well as the treatment of opiate and substance use disorders. A lot of work in this space because we know that we have gaps in being able to measure that effectively. So many technical expert panels mandated by Congress to have, for example, we have an opiate technical expert panel convening soon to help us think about how to get smarter measures in this space. And then finally, our last measure area is around risk-adjusted mortality. So a great example is around our hospital 30-day all-cause risk standardized mortality rate, that following heart failure and the hospitalization, and that's in our hospital value-based purchasing program. And one of the things that we actually have that I didn't include a slide on, but we have an inventory of all the measures within our CMS programs. It's on CMED. It's the Center of Medicare and Medicaid Services Measure Inventory Tool. And this actually allows us, and we actually have a category on meaningful measure areas. So each of those measures actually has to have a primary meaningful measure area, which helps us as we're thinking about where there might be some duplication in area and efforts and where are some gaps. So it's been very helpful in using this tool set to take a better look at the measures within our programs. So as I mentioned, this initiative and this framework has helped us align with the existing programs to identify and select measures. But it also helps us with the story as we're trying to engage with providers and helping them focus on patients and improving the quality of care that would be meaningful to them as they're taking care of them. And the intention really is for us to be capturing the most impactful and highest priority areas for all clinicians and specialists, and has guided us actually in our rulemaking list. And a great example really is in this last year. We applied this framework across our programs, and by doing so, we actually were able to remove overall 79 measures across our programs. MIPS, we removed 26 of them, while we added other outcome and appropriate use measures. And then when you look at our measure inventory across the agency now, you can see that over 50% actually are outcome-based, whether they're outcome measures or patient-reported outcome measures. And then with this effort to move toward electronic submission, we're seeing that we're making some progress, where 22% of our measures are able to submit it through those means. And we've been doing more work across measure alignment internally, so looking at our Medicare Advantage plans through Medicaid and its exchanges, through our work with the innovation team with the models, as well as across our post-acute care settings. And then there's a core quality measures collaborative that has reconvened in the last several months. This is an opportunity to work with commercial payers along with the federal agencies in thinking through if we can agree to a core set of measures that can allow for some alignment across commercial payers as well as through the federal enterprise. And so for now, those mostly are around disease-based core sets, but there's been a lot of thinking about next steps and how we can move this forward and be more perspective in our thinking. And so I mentioned electronic sources, and I will say that is something that we are looking at, following carefully in terms of the evolving technology and seeing ways that we can partner with our colleagues and with ONC and how we can help support more of this exchange of information through electronic means. We think that partly why we want to emphasize this as we're moving forward is we feel that it's important that we get data back to our providers in a way that's timely and actionable, and we think as much as we can incentivize getting this data in an electronic form, it could allow for more of that timely feedback and the construction of measures that could allow for that as well. And as I mentioned, we're working with CMMI as well on the use of artificial intelligence to help us predict outcomes. So in terms of the next several years, this is something that we're thinking of in terms of strategy and looking forward to partnering with those in the community to move this in that direction. I want to end with just sharing with you our websites because there's a lot of information here, and it also offers you an opportunity to provide feedback to us. Part of what we're doing at this stage is trying to take this information out to the public and get as much feedback as we can around this framework. Did we get it right? Are there things that we're missing? If we have time on this call, we'd love to hear from those that are participating if they have some ideas as well. But for us, this is really a bidirectional ongoing conversation in trying to get to a framework that we can all use to drive toward getting meaningful measures within programs and through core sets, as I mentioned. And then the other page we have through that website are fact sheets. And so this gives you more kind of Q&As of the genesis of this initiative along with some additional detail around the definitions and the types of measures that are within each of these areas. So I'll stop there, and Kevin, maybe I'll hand it back to you to see if there are any questions from the group.